For nearly 60 years, St. Jude Medical Center has been one of the preeminent hospitals in Southern California delivering high quality and compassionate care. Our patients not only expect excellent care, but commitment to safety. And safety is the responsibility of the entire healthcare team. The surgical pause or timeout is an essential, but not the only component in eliminating an adverse event. It is an opportunity for you to ensure our patients are in a safe environment. This video depicts the protocol the healthcare team must utilize for any surgical or invasive procedure. Prior to the surgical procedure, the surgeon and team must conduct a briefing, review any significant facts, anticipated events, special needs, and address any specific concerns. The timeout is a time when all activities should stop. All procedural members are involved and verbally confirm after draping and prior to incision or start of a procedure that the following information is correct. 1. Patient identification using the name, identification bracelet, and FM number. 2. Surgical or procedure consent. 3. Side and site level. 4. Diagnostic images properly labeled and displayed. 5. The mark should be visible after draping on the patient. 6. Patient position. 7. Implants and special equipment as applicable. 8. Prophylactic antibiotics started as applicable. 9. Safety precautions based on the patient history. And 10. Spinal surgery X-ray to be done per policy. And finally, at the end of the procedure, a debriefing or sign-out must be performed. Specimens are verified, the procedure was verified, the count was correct, any preference card updating necessary, equipment problems, and any special patient care needs.
Okay, I've just finished prepping and draping this patient. We need to put a right chest tube in for a pneumothorax. So Ms. Brown, before we get started, we have to do one last thing, and that is go through our checklist and make sure everything is right. So Bernadette, I'm going to call a timeout now. The first question is, do we have everything together?
Everything's ready, Dr. Hardiman.
Okay, including the 12 French chest tube and the 501 connector. We got the kit, and you have a Pleurovac too.
Yes, Dr. Hardiman.
Okay, and we have the right patient, Taylor Brown.
Let me just go check your armband, Mrs. Brown. This is Mrs. Taylor Brown, FM 000-714-992-3000.
Okay, Taylor, you agree that you're Taylor? Okay, and we have the consent, which is accurate and signed.
You can see the consent, Dr. Hardiman. It says Dr. James Hardiman, right chest tube placement of Mrs. Taylor Brown.
Okay, very good. And we agree that the side is the right and the site is the second intercostal space anteriorly. And we've confirmed that by looking at the chest x-ray that you put up on the screen there.
The site is confirmed. It's the right side, and we have reviewed the correct x-ray.
We also agree that we both can see the skin marking. It's readily visible there.
I can see the marking, Dr. Hardiman.
Okay. Are there any allergies?
No allergies.
Okay. And Bernadette, do you have any other questions?
No questions. We are ready for a right chest tube placement for Mrs. Taylor Brown.
Okay. And Ms. Brown, this will just take a few minutes, and your breathing is going to feel a lot better when we're done. Okay, you did great, Ms. Brown. We're all done. I think it went very smoothly. Did you find that we encountered any problems, Bernadette?
I think we did everything good, Dr. Hardiman. Everything was in place before we started. We checked everything we needed to check, and you can tell that she's really doing well right now.
Good.
The timeout is paramount in creating a culture of absolute safety. It is an opportunity for all of us to ensure that we're on the same page. The physician sets the standard as well as the tone for the entire healthcare team. The timeout should be routinely and predictably done before any surgical procedure. It is an opportunity for the entire healthcare team to speak up if you sense something is not right. I have worked with many of you over the years and know that you are all dedicated healthcare professionals and want nothing more than to ensure patient safety. Implementation of this physician-led protocol will help assist us in attaining this most important goal.